Hi, welcome. I am CCarter, and I'm here with a new show. The new show is called Truth with CCarter. I am creating this event or this venue so that we can talk about the issues in our community that is plaguing our community. One of the issues we're having is HIV. We all need to have more conversation pertaining to that. But before we get into that, I just want to let you know why this is. Recently, I found out some statistics and pretty much decided that how can I bring this message across to the audience who needs to hear about it. And therefore I decided to create this talk show that will address the issues that I believe supposed to be important to us. So thank you for tuning in, and I'm going to introduce my guest, which is one of my co-workers as well, and he has much to say about this topic. If you notice, there's pictures around you too. That's a part of the whole campaign that we're working on. This is Edwin, and I'm going to give you a minute to introduce yourself and tell us about your qualifications.
Hi, I'm Edwin. I'm a physician assistant. I've been a physician assistant for 26 years. My primary work has been in HIV, which I've done for 24 years. I'm a certified HIV specialist, and I'm currently doing extra work treating STDs in communities of men who have sex with men over the age of 19.
I just want to thank you for taking the time out.
Sure.
To join me for the first taping. One of the things over the years I found out about myself was that in order for me to learn, I got to be open. And over the years, I came to not only you, but other individuals that work in the positive health department and ask for information about my community and what HIV is doing, what's the best way to be safe. And I find that you guys have been really helpful. So that's why I wanted you to be a part of the first taping. So for now, I just want to touch on some issues of the latest statistics. The last time I checked, which was, we're in now June, about the beginning of June, I found out that the latest statistics stated those who are infected now is between the ages of 14 and 29. Last year when I checked, it was between 14 and 27. So obviously the age gap has now widened even more. Not only that, that makes up 75% of who are showing up that is infected. The other 25%, which was one of my biggest concern, is women who were in monogamous relationship, thinking that their spouse or their loved one or whoever was being faithful. Now, can you, as a physician assistant that have been in the field for 24 years dealing with this issue, can you touch on how do you see it changing from when you started to where it is now, because the statistics are pretty much now getting higher and higher?
Well, the statistics are accurate. From 2001 to 2011, the number of HIV rates in men who have sex with men have pretty much doubled. That's just a 10-year gap. Even at a time when there is medication that can pretty much treat the disease, control the viral load, and people are doing well. And there's a lot of advocacy. People have been out in the arena educating people. So why is it that people at that age group, who is actually younger than HIV itself, becoming infected?
I get angry when I heard about that. I think that's why I came up with the whole thing where we first got to know our truth. I think knowing your truth, where you stand. I've looked over the years and heard different titles that men that have sex with men tends to change. And again, whatever floats your boat, floats your boat. I've been bisexual as long as I know myself. But doesn't mean that I live both life dealing with men and women at the same time. Now, we all have our histories. We all know pretty much that if you do something, there's a consequence behind that. I think most of the young people that are being infected don't think that there's any consequence. So I'm just here to have a good time. Whether it's a sex party, whether it's a club, you meet someone, maybe you get a fake ID and show up in a club, you go home with an older guy. One of the thought I had when I heard age group 14 to 27 or 14 to 29, I thought, how does a 14-year-old get HIV? Unless he's having sex. Most 14-year-olds are not drug users, so obviously, they're not doing that type of drugs. So now the question is, where is the parents? And I think that's where I think we need to start having that dialogue where we can have a conversation with our teens. My brother is now 16. The other younger one is now 11. We already had that conversation about sex. And I'm not afraid or ashamed to have that conversation. And whether they are straight, gay, or still figuring out themselves, having the conversation is the most important thing. Do you think that?
Well, that's absolutely correct. I think part of the problem that we have is that, first of all, we have to understand that many parents are very ignorant about HIV themselves.
True.
It does not happen at home.
Yeah.
It happens out there to everybody else. It happens to the gay population, as I see it. It happens to people who are using drugs. It happens to people who are sleeping around as they think. People don't seem to realize it just takes one chance to become infected.
Exactly.
And that's really what the issue is.
Exactly.
I like to use a lot of experiences, stories from people I've met in my work. And I just recently had a young man who initially came in for testing, counseling, because he has some sores on his penis. It turned out to be herpes simplex. And he freaked out because, oh my God, I have herpes. He wasn't worried about HIV. So in getting a history from him, let me just add, he is actually here from Haiti. He moved here to help support his family back in Haiti. And, he has the freedom to open up into his lifestyle. He identifies as bisexual, okay? He has intents on getting married and raising a family, but is extremely active in the men who have sex with men community, just to use that term, because that's what we're going to see a lot when we identify men who identify as either gay, bisexual, whatever it is they categorize into men who have sex with men. So I treated him for herpes. The lesion's resolved. He came back because he had another lesion in his genitals. I did send him to the Department of Health because it appeared to be something like chancroid, which is another uncommon STD here in the United States. It's more common in third world countries.
Wow.
So could he have been exposed at home? Maybe not, because he's been here for a while. But the fact that he's out there posed a huge risk.
Yes.
Turns out that he had syphilis. So that was treated. Ironically enough, he received that injection on a Friday morning, and he was in a rush because he had a date Friday evening.
Wow.
And his idea of a date is meeting somebody he saw on, I think it was Grindr, for sex. And people's perceptions of dating is not what it was back in the 1950s, where you get pinned and people see each other, and it doesn't tell you get married that you have sex. It's a time when people go, hi, how are you? My name is, let's go. And that's what his plan was. He most recently returned again because he reports in the past 2 weeks he had sex with 10 different guys. He used condoms with 8 of them, but 2 he did not. And one of the 2 were positive.
Oh my God.
Yeah, and he is not aware of any information whether he has an undetectable viral load. And it was kind of frustrating for me because we've had many conversations about the risk he was taking, and he used every possible excuse as to why he should not use condoms. So I asked him a few questions, and his thing was, well, I can't get HIV because I'm a top and because I use lube. Okay. Well, there's a little problem there because Yes, he's at top, but his risk is still there.
Exactly.
And, people think that, I'm not receiving any semen in me per se, doesn't mean you cannot get it. He's also uncircumcised. And with that, many people don't know that an uncircumcised male has a higher propensity for becoming infected than circumcised male. And these studies were done initially in Africa, where the rates of HIV transmission is extremely high. About 50% of Africa is infected with HIV, both men and women. The studies were done in men who have sex with women, primarily, and studies have shown that uncircumcised men were infected at a higher rate than the circumcised men. And there was a push for circumcision, but that didn't seem to go well. But these studies were repeated many times.
Doesn't mean because you're circumcised, doesn't mean that you're not at risk just the same.
Absolutely.
It's just that it's now easier. And I think if we get graphic with it, which I've spoken to my family about this, uncircumcised penis tend to get bruised during the course of sex. Mm-hmm. That leaves a window of opportunity. Mm-hmm.
Well, if I can just add this piece here, uncircumcised or foreskin has a specific cells called Langerhans cells. And these cells are sort of like magnets. They actually suck up germs and basically help bring it up so the body can fight it off. But with these Langerhans cells, they're not only sucking up germs, they're sucking up HIV. So the risk becomes higher. Now the studies, if I may go back to that, although the studies were done in men who have sex with women in Africa, we attempted those studies here in the United States in men who have sex with men. One study showed there was a risk for transmission. Another study said it was indeterminate, so it was unclear to some degree. So me as a clinician, I don't feel comfortable telling somebody the studies were negligible or probably not a risk. I'd rather err on the side of caution.
Exactly.
And tell my patients or tell anyone who's seeking information or even volunteering, as I do when I have conversations with people that I know, that there is a risk. Studies have shown, and these are just studies done in X number of people in certain groups, there's a risk. How much of a risk, I really cannot say, because there aren't those facts to support it or extensive research to support it. But a risk is a risk regardless, and what do we do to minimize them?
I think that is one of the biggest things we need to address, because once I started to research for my own personal self about HIV and STDs within our community, one of the statistics I found out years ago was 4% of the population who contracted HIV caught it through oral sex. Mm-hmm. Now, I find that most men, I'm from Jamaica, so therefore there is some taboo in having this discussion to begin with, much less coming out saying that I'm bisexual. I think most men is okay receiving it more so than giving it in some cases. When it comes to a woman, I think, again, depending on your culture, we say certain things, but the ignorance is that we're not being honest. And, after all, this is truth talk. So let's talk the truth. The truth of the matter is, once the light goes out, anything goes for most people. We just don't address it publicly when the light comes back on. Right. I think, dealing with whether it's that 4%, that 4% chance of catching it through oral sex, that is still a risk. So therefore, how do we prevent that? Knowing your status, knowing the person who you're going to sleep with, their status. And if you don't know their status, use a condom. Use dental dams. Use whatever it takes to protect your life. Most of the young people that I work with, not only work with, but live on the block where I live, when I get the statistics, I come home and I share it. And one of the things that I share with them is that, regardless of whatever you do, whether you're straight or gay, yeah, you're 18, 19, 20, 21, 22. At the end of the day, you just began to live. So therefore, you're looking for 20 years down the road, you're going to find a wife, you're going to have a family. Be careful what your actions are now, because it has a repercussion. And it's going to affect you later on. So one of the scenarios I proposed to them was, what if you find a wife at 30 and she decided to now tell you, listen, before we met, or even before you get married, say you met her and she's now, you're dating and you're now asking her history, and she tell you, by the way, when I was 21, I had some group sex and I contracted the virus at that point in time. I said to them, what's the truth? The truth of the matter is most men are going to go, no thank you, and they're going to move on. They don't want to be in that area of dealing with that. You know, I recently also met a young man when I went to purchase a new phone, and met him, and you know, the Spirit just says, have a conversation, start a conversation. So I started a conversation. I told him about the caution campaign that I was working on, and you know, it's meant to bring conversation, and meant to bring a thought. You having a thought in your head of, what have I done to put myself at risk? So while having a conversation with the young man, less than 5 minutes in the conversation, he says to me, I don't normally do this, but from the atmosphere you created for me, I feel uncomfortable enough to share. And he says, I've been diagnosed with HIV for the past 2 years. And he says, it's hell. He says, do you know how much money it costs for my medication? It's almost $2,000 a month. When he told me that, I'm going, that's most people rent. And most people can't even afford, depending on what status of job you have, you can't even afford to pay $2,000 a month for rent. So what's happening in our community is now that issue of not only are you going to contract it, but how are you going to take care of yourself? And folks in the hospital, which is one of my issues, tend to tell me, well, it's not a death sentence anymore. And my question or my thought is, how is it not a death sentence? You know, yes, you can live because of medication, but what life is that to live? In my opinion, I believe that if you can behave or correct your behavior now, then when you do find the love of your life and you want to spend the rest of your life with, you can have swinging from the chandelier if you want to, but don't have to worry about infecting them or them infecting you.
Well, I think we have to remember, though, that the facts as they are today are what they are. So as a medical person, yes, HIV is no longer considered the death sentence that it was once referred to as. It is has been officially declared a chronic illness, just like high blood pressure, just like diabetes, something you can live with. The expectation is that you will live your full lifespan. So if you were going to live as a negative person till 75, then the expectation is that you will live to 75 being positive as well. Yes, there is medication. We can control the virus. So those are the facts.
Yes.
But as you said, that's not a way to live. Not to say that, you know, people who are positive are living this miserable life. They're living.
They're not.
Many people who are taking responsibility for their lives are living normal, healthy lives, are doing well with their medication.
Exactly.
They keep their appointments.
Yes.
They take the medication that's prescribed. Any issues that come in.
So those are the responsible ones.
Those are the responsible ones, but we do have people still with issues who, you know, struggle with it, and, you know, we can work with them. But my point is that why get to that point if you can avoid it?
Exactly.
If you're negative, stay negative. One of the perceptions that a lot of young gay men is that, well, because I am gay, therefore I will become positive. So it's just a matter of when. I remember at a different institution, a few years ago, I was seeing a young man who was a porn star, actually a famous porn star. I had to Google him up to confirm that he was famous. And during one of our conversations, because I had to put him on PEP. Apparently, he was shooting he had sex with someone because he does escort services, massage. And he drew a lot of blood from the person and was at risk for HIV. He was a partner of unknown status, so he didn't even know the situation. In the event, he had gotten a sore on his penis prior to that encounter from using condoms during filming of a movie. It was a long day and so on. So in an event, during the conversation, he was telling me that, you know, I was at a party recently and, you know, I was looking around the room and I was saying, that one's positive, that one's positive, that one's positive. When is it going to be me? And I told him, who said that you have to become positive?
Exactly.
And he didn't seem to really get it, like, what do you mean? So we had a conversation. And we talked about his massage business on the side, which can include sex.
Happy ending.
Happy ending, and happy endings depending on what it is that people are looking for. Because when people are paying big bucks for more than just masturbation, you're gonna give it. So I approached them from the angle of, he had mentioned, I'm not even enjoying this. This is my work. So I approached them from the angle. Business, okay. So you're telling me you're having this sex, you're putting yourself at risk, and you're not enjoying the moment? He goes, no, it's work. Then you know what? You're a businessman, right? You have a business, and all businesses have rules.
Exactly.
Okay? This is the service I provide. These are the parameters that you need to follow. If you cannot meet those parameters, or my business doesn't satisfy your needs, then therefore you need to find someone else or another business that will. And that put a new perspective on it for him, and he agreed. Now, whether he's practicing it, I don't know. I have never seen him again. But it just goes to show that what people's perceptions are. As I said earlier, with my young guy with the lesions on his penis and the multiple partners, he believed that because as a top, he was not going to get infected. Because he uses lube, he was not going to get infected. And during our conversation, he spent the entire time trying to look for alternatives to using a condom. He didn't want to use condoms. His perception, which actually quite amazed me, what people's cultural beliefs are. You touched on culture earlier. Yeah. In his mind, being a Caribbean man, he thought that you use a condom to prevent pregnancy with a woman. You do not use condoms when you're having sex with a man, because if you use a condom, that confirms that you're gay. And he was not gay, he was bisexual. So but this is belief, his belief. This is the cultural aspect of his life.
So that's living in your, or in his truth.
It's his truth, or the truth of the community he's with. Yeah. It's not in ours. Remember, we're here in New York, in Brooklyn, where we know better. But if people have certain belief systems, and they will stick to it. Again, in a little story, I was doing HIV testing at a park with the program that I'm with a few years ago, and a young lady comes in to be tested. She had a small child in a stroller, and one of the questions I asked is, why do you need to be tested? Assessing pretty much a risk factor. Yeah. And she tells me, well, I am married, I'm monogamous, but my husband's out of the house. I don't know what he's doing. Fair enough. Exactly. And then her mother burst into the little tent that we were in, and she was, I don't know why she's getting herself tested, because we're evangelists, and evangelists don't get HIV. Okay. And of course, I put on my professional hat and I said, well, HIV does not discriminate. Exactly. No, evangelists don't get HIV. And okay, stopping here.
God is going to save me.
Yes. Don't get me on that topic yet. There was just no reaching this woman. And at this point, she was not the person being tested. That's her belief. And I'm going to let it go. Mm-hmm. But people think that, yes, certain people are exempt from HIV, and don't want to believe that we are all at risk. Unless you're living in a plastic bubble, you're at risk. The majority of women that I treat are women who have been married for many, many years, had one sexual partner in their entire lives. We're talking about women in their 40s, 50s, and 60s, one partner. And that partner, husband, was the one who infected them. How did they get infected? IV drug use, the age of Viagra. Yes. You have a 60-year-old guy who can't get an erection. Now he gets Viagra. He wants to feel like he's 16 again, picks up a prostitute, and has sex, and then goes back home and gives his wife HIV. It only takes one time, and no matter how safe you think you are, the only safety that you really can be sure of is having a totally monogamous person in a relationship, and being able to ensure that.
And even though, I've been in a relationship for the past 7 years, this year is going to be 8, we get tested just the same. We are monogamous, we're not dealing with anybody else, but I need to know for my records. Just like you get your blood pressure taken, or you get your cholesterol checked, I need to know all my status, because at the end of the day, I'm responsible for me. And I think that is the biggest thing where, even in the West Indian community, I think most men are afraid to get tested.
Well, I'm going to say most people are probably afraid to get tested. But again, if we go back to monogamy for a second, even words get twisted around.
Mm-hmm.
People are monogamous, but there's always a but someplace.
There's a loophole.
Yeah. I recently had a young girl come to my office who was recently infected, actually in May, so it's been about a month. She has been with one partner for about 4 years. She has a child with him. And they had a fight and they broke up for about a month. And in that month, she had one sexual encounter. And she went back to her partner. They got back together and, she became pregnant. And during the pregnancy testing, they tested her for HIV and she was positive. And the partner was negative. It took that one person that she met that one time. And she had been monogamous all along. In her mind, she was still monogamous. Mm-hmm. She only just had one incident, but other than that, she's monogamous. That little other than that was the risk factor.
Exactly.
Okay, the partner is negative.
One of the things that I think also about is the population of where HIV is spreading even more so. So when I found out about the statistics, I realized that the statistics about HIV was dealing with the Bronx. So Bronx last year or year before last was the almost the breeding ground. It was number one on the charts pretty much of places that are infected the most out of all the tri-state area. Then this year when I went and do my research on that, it's my neighborhood, which is Bed-Stuy. But of that, what you know?
Well, the facts are that in that group that we talked about of increasing rates of HIV transmission have occurred in young men. The majority of them did occur in the highest populated area, Bed-Stuy, Bushwick, Crown Heights, Williamsburg. Those are the ones with the highest new HIV diagnoses.
Okay, folks, we had to end it here for part 1 of our show. But for part 2, you can visit our YouTube channel. Just do a search for The Truth with Carlos Carter. We thank you for watching. Hope you enjoyed it.